Good day everyone. It is nice to see you again. Welcome to our Any Learning, as our learning community. Lesson 4. Critical Care Nursing. Artificial airways. Mechanical ventilation. Controls and settings are as follows. Tidal volume, rate, size, fraction of inspired oxygen, or FiO2, peak airway inspiratory pressure, continuous positive airway pressure, positive end expiratory pressure, PEEP, and pressure support. 1. Tidal volume is the volume of air that the client receives with each breath. 2. Rate, the number of ventilator breaths delivered per minute. 3. Size, the volumes of air that are 1.5 to 2 times the set tidal volume, delivered 6 to 10 times per hour, may be used to prevent atelectasis. 4. Fraction of inspired oxygen, FiO2, the oxygen concentration delivered to the client, determined by the client's condition and arterial blood gas levels. 5. Peak airway inspiratory pressure. This is the pressure needed by the ventilator to deliver a set tidal volume at a given compliance. Monitoring peak airway inspiratory pressure reflects changes in compliance of the lungs and resistance in the ventilator or client. 6. Continuous positive airway pressure. The application of positive airway pressure throughout the entire respiratory cycle for spontaneously breathing clients keeps the alveoli open during inspiration and prevents alveolar collapse, used primarily as a weaning modality. No ventilator breaths are delivered, but the ventilator delivers oxygen and provides monitoring and an alarm system. The respiratory pattern is determined by the client's efforts. 7. Positive end expiratory pressure, PEEP. Positive pressure is exerted during the expiratory phase of ventilation, which improves oxygenation by enhancing gas exchange and preventing atelectasis. The need for positive end expiratory pressure indicates a severe gas exchange disturbance. Higher amounts of positive end expiratory pressure, or more than 15 cm water, increase the chance of complications, such as barotrauma tension pneumothorax. 8. Pressure support. The application of positive pressure on inspiration that eases the workload of breathing may be used in combination with positive end expiratory pressure as a weaning method. As the weaning process continues, the amount of pressure applied to inspiration is gradually decreased. We have 2 types of alarms that causes a ventilator alarms, and these are high pressure alarm and low pressure alarm. 1. High pressure alarm means there is an increased secretions in the airway. Wheezing or bronchospasm causes decreased airway size. The endotracheal tube is displaced. The ventilator tube is obstructed because of water or a kink in the tubing. Client coughs, gags, or bites on the oral endotracheal tube. Client is anxious or fights the ventilator. 2. Low pressure alarm means there is disconnection or leak in the ventilator, or in the client's airway cuff occurs, and the client stops spontaneous breathing. Complications of ventilator are as follows. 1. Hypertension caused by the application of positive pressure, which increases intrathoracic pressure and inhibits blood return to the heart. 2. Respiratory complications such as pneumothorax or subcutaneous emphysema as a result of positive pressure. 3. Gastrointestinal alterations such as stress ulcers. 4. Malnutrition if nutrition is not maintained. 5. Infections. 6. Muscular deconditioning. 7. Ventilator dependence or inability to wean. 8. Ventilator associated pneumonia. And 9. Barotrauma. Weaning. A process of going from ventilator dependence to spontaneous breathing. And the following are the things to consider during weaning. Synchronized intermittent mandatory ventilation, SIMV, T-piece. and pressure support. Synchronized intermittent mandatory ventilation, SIMV. The client breathes between the preset breaths per minute rate of the ventilator. The SIMV rate is decreased gradually until the client is breathing on his or her own without the use of the ventilator. T-piece. The client is taken off the ventilator and the ventilator is replaced with a T-piece or continuous positive airway pressure, which delivers humidified oxygen. The client is taken off the ventilator for short periods initially and allowed to breathe spontaneously. Weaning progresses as the client is able to tolerate progressively longer periods off the ventilator. Pressure support. Pressure support is a predetermined pressure set on the ventilator to assist the client in respiratory effort. As weaning continues, the amount of pressure is decreased gradually. With pressure support, pressure may be maintained while the preset breaths per minute of the ventilator gradually are decreased. Nursing care are as follows. 1. Assess vital signs, lung sounds, respiratory status, and breathing patterns. The client will never breathe at a rate lower than the rate set on the ventilator. 2. Monitor skin color, particularly in the lips and nail beds. 3. Monitor the chest for bilateral expansion. 4. Obtain pulse oximetry readings. 5. Monitor ABG results. 6. Assess the need for suctioning and observe the type, color, and amount of secretions. 7. Assess ventilator settings. 8. Assess the level of water in the humidifier and the temperature of the humidification system, because extremes in temperature can damage the mucosa in the airway. 9. Ensure that the alarms are set. 10. If a cause for an alarm cannot be determined, ventilate the client manually with a resuscitation bag until the problem is corrected. 11. Empty the ventilator tubing when moisture collects. 12. Turn the client at least every 2 hours, as prescribed, to prevent complications of immobility. 13. Have resuscitation equipment available at the bedside. 14. Hyperventilate the patient before suctioning. And lastly, provide note and pen to the patient to communicate his needs. Thank you for listening. Have a good day and be safe. Agyamanag.